Hi everyone, I'm Dr. Arshad from the Brooke Surgery, and I'm joined by Sally Cumner, who's the PCN manager. And Sally, do you want to say hi to our viewers?
Hi, I'm Sally. I'm the Primary Care Network Manager based in Hyde, looking after the 8 GP surgeries within our Primary Care Network.
Thank you, Sally. So, as you may have seen, Sally joined us before for a live video about our flu drive here, and it's been a very successful campaign. However, looking at the numbers, there's a lot of patients that actually haven't had their flu vaccine yet, and this video is to kind of address some of the questions that we've had up until now, and perhaps make you aware of the benefits of the flu vaccination. So, we are aware that there's a lot of talk around the COVID vaccine. However, we mustn't forget about the flu vaccination. Now, one thing that's worth mentioning is that the flu vaccine can actually kill healthy people, including children, the elderly, can be affected. However, the good thing is you can be vaccinated against the flu and to prevent getting the flu and suffering the effects from the flu. Some of the effects of the flu can be things like having fever, body aches, inability to perform regular tasks, which can mean difficulty in caring for loved ones, extended time off work, and general, kind of stop to your life when you have flu can be really debilitating. And this year, we need to protect ourselves more so compared to previous years, and particularly the vulnerable around us as well. And this is due to the COVID outbreak that we're going through. The World Health Organization estimated that between 290,000 to 650,000 deaths related to the flu globally last year due to seasonal influenza. So it's very important that you actually get your flu vaccination. And by getting the flu vaccination, you're not only just protecting yourself, you're actually protecting your loved ones. So, for instance, if you live with an elderly relative or someone with multiple illnesses, or even children, you will also be protecting your loved ones by getting the jab for yourself. And that's an important thing to mention. Often we think, well, we feel fine and we'll be okay, but we have to think about the people around us as well, particularly our loved ones. And it's common for people to be worried about any medication or immunization. And it's worth speaking to your doctor or your nurse if you're worried about anything in particular related to the flu vaccination. To be clear, the jab itself cannot give you the flu, but sometimes there are some mild aches associated with the flu that when your immune system thinks you may have the flu itself, but that's just a part of the process. And I'm going to speak to Sally Cumner now about what we've done here in Hyde and the neighbouring areas with the flu drive. So Sally, we've done this flu drive, and can you tell our patients viewing what the flu drive is about and how it works?
Yeah, certainly. So we started this back in September, which seems like a lifetime ago now. So we first started on the 21st of September, and up until today, we've vaccinated 9,000 of our patients in Hyde, which has been great. And we've done this through various offerings this year. So we've done the drive-through, and we've also had local pharmacies who you've been able to book your appointment with directly via the app, flu booking system that we developed earlier in the year. So it gave people the choice of where they wish to go for the vaccine. So we would strongly encourage anybody who can drive or who can get a lift to the vaccination station to use the drive-through to ensure that any vaccines that are available in stock in the pharmacies can be used by those patients who are unable to drive or don't have access to a car. So as I say, we've manned this via all of our staff from varying practices, from the 8 GP practices in the Hyde Primary Care Network, which is including the Brooke Surgery. We've had our healthcare assistants, we've had our Healthy Hyde team nurses, who some of you may have seen, who have been doing the questions and checking that you're well and that you consent to the vaccine. It's a really quick and easy process, and the feedback that we've had from patients has been absolutely overwhelming. The patients that have used the vaccine drive-through have all commented on how incredibly safe they've felt, how the quick and easy it has been, how lovely the staff have been, and how actually they'd like many services, if possible, to be delivered in the way that we've delivered the flu vaccine. And I think we've had an incredibly overwhelming response to the question of whether you would like to have your flu vaccine delivered in this way in subsequent years. And I think out of our 9,000 patients that we've seen, I think I can probably count on one hand how many patients have said they would prefer to go to the GP surgery. And the reason for that is exactly what I just stated, is that it's very quick and easy to access. So it's on Walker Lane. It's at the active leisure centre, the pool. You would pull up onto the car park and you'll see there's some blue porter cabins. You simply drive up. One of the nurses will ask you a few questions, drive round, have your vaccine, and then feel free to drive away. Obviously, if you've never had the vaccine before, what we do ask you to do is to pull up into one of the bays locally and wait for a few moments just to make sure that you're okay and you're well following your vaccine. As I say, we've had a great response. We've had 9,000 people through the vaccine centre since we started in September, but we've still got room for more. So it would be great if we could really push the flu vaccine again and get as many patients of our population vaccinated as possible.
I mean, I would just like to echo that, Sally. The patients that have been on the flu drive here at the Brooke Surgery, they found it a wonderful experience, seamless, really straightforward, very quick. And I think the key thing here is safe. In the world of COVID, where we don't want people to queue up and stand side by side, the flu drive has worked wonders. And I can see that echoed in some of the comments here. I can see a couple of people are posting that they've had it and they thought it was great in and out. And you know, thank you for sharing your views here, guys. And Sally, actually, you know, the Healthy Hide team won an award for this, didn't they? A national award for the flu drive and how successful it was.
Well, sorry to correct you, we didn't win award for flu, but we did win an award for Primary Care Team of the Year, and that was for the work that we've done regarding patients in care homes and making patients have a voice again who have gone into the care home. But we work as a team, so the Healthy Hide team has got an array of nurses and health and wellbeing practitioners and care coordinators, and we're working really hard to develop new and initiative ideas to increase the care of patients in Hyde. But this was just one of the areas that we started to focus on, which was flu, and that was all due to the pandemic, and we wanted to make it as safe as possible for as many people as possible.
Absolutely. So it's a safe way for people to get their flu vaccination, and we've posted the link in the comments on how you can book on. The eligibility criteria is on that link, and also which surgeries are participating are also on that link. And a couple of more questions I thought we might be useful asking you, Sally. What if a patient who is eligible is having difficulty booking online? What should they do?
So, because the system is not 100% foolproof, and we will inevitably have patients that are eligible for the flu vaccine, but the booking system is saying no, and that could very well be due to the fact that that patient is a family member of somebody who's shielding, so therefore we wouldn't necessarily know that you're entitled to a vaccine. You must contact your GP practice. Your GP practice will book it for you. They can override the eligibility check to make sure that you get your flu vaccine. They will know from your medical record and the details that you give them that you're able to have a vaccine. So I would really strongly recommend that you contact your GP practice if you have any difficulties at all booking for your flu vac.
Absolutely. So I guess, you know, the key things to stress here is that the flu vaccination is vitally important, particularly this year more than any year before. The process we have here, that we have set up, is safe. It's easy to book onto, and if you can't book onto, then the GP surgeries will help you with this. And it's manned by staff that you already know, staff that you've seen at the general practice, wherever you are, wherever you're registered. And there's options to book on. So definitely use that link that we've posted. If you're eligible, book on. And if there's any questions you have, you can post it in this video and we will endeavour to answer them as time goes on. I think most of the questions already here have been answered, and I think there's just comments here of people that have had it, and thank you for commenting on how useful you found the system and how easy it's been. So Sally, thank you really. Is there any parting comments you want to mention? Anything to add?
No, I would really like to thank everybody who has used the drive-through and has been really kind and commented on Facebook or to the practice or to members of staff that they have found it really useful, or you've found the experience really good, or any comments really, because as you possibly imagine, we're all at our wit's end at the moment with the amount of work we've got. So any compliments that we get is much greatly received, because they're all trying to do a really difficult job in a really difficult time. So thank you very much for all the comments, and thank you for being so supportive of having a flu vaccination in a very different way to any other area in the whole of Greater Manchester, in fact.
Absolutely. So thank you to all the patients, and those who haven't got it but you're eligible, please do book on. And if you have any problems, let us know. Thank you, Sally, once again for joining us.
Thank you.
I'm sure if there's any questions, we'll work together to try and answer them. So thank you everyone for tuning in, and thank you, Sally.
Great, thank you.